Now I'm live. Okay. All right, you guys, I think we're live here on YouTube, and let's see if it's working. I'm not seeing myself on my YouTube, so we'll see. Oh, there we are. Now I'm live. All right, awesome. All right, took me a moment. This is my first live, so welcome. I'm gonna turn my volume down over here. All right, awesome. So welcome, everybody. We are talking about hormones, menopause, perimenopause, and more. And I'm going to be answering your questions today. So I have questions here on my iPad. Hi, I'm Dr. Michelle Sands, naturopathic physician and hormone expert. So I am so excited to see you guys here. I will be answering your questions that were sent in. You can feel free to pop your questions down in the chat box, if you can see where you can ask questions, and I'm going to answer all of those. So I'm not going to spend a bunch of time with intro. We're going to get right into some questions right now, because that's what you guys really, really want to know. And the whole purpose for these live Q&As, and really my channel in general, is that there's so much misinformation about menopause, perimenopause, hormone replacement, and so many women are heading into that time of their lives with very, very little information about what they can do, how they can resolve their symptoms, and how they can actually extend their life and reduce their risk of osteoporosis, heart disease, dementia, look and feel younger, have amazing relationships, moods, memory, sex life, the whole 9 yards. And so we are going to talk about all of that, no holds barred today. I will try to answer the questions as best as possible. And then I'm also going to be giving away some prizes because it's like, yoo-hoo, it's my first YouTube live. So we're going to celebrate that. And by giving away some prizes, I have some of our hormone healthy supplements. So our Daily Glow is a daytime supplement that helps with thyroid support, estrogen detox, adrenal support. So all things important for hormone health. And then the Glow PM helps you calm and relax you, helps with your neurotransmitters, also has ashwagandha to help support your adrenals. So we're going to be giving away packs of those towards the end of the Q&A. So stay with me if you want to win those prizes. So let's go ahead and let's get into some questions that were asked. So number one question, the first one that came in, or at the top of the list anyway, is do you recommend to do a detox before hormone testing or for testing for hormones? So I guess the question, do you have to do anything special before you test your hormones? Absolutely not. You want to test your hormones as they currently are. And doing a detox, I mean, that can definitely help your overall health, but it's not going to really change your ovarian production so much, especially if you're in perimenopause or menopause. If you are younger, if you're in your 20s or 30s and you're having hormone issues, then yes, doing a detox, actually not just doing a detox, but living a detox lifestyle so that you're eating whole real foods, you're getting exercise, you're avoiding chemicals in your cleaning products and your facial products and your beauty products, and you're not drinking out of plastics, because there's so many hormone disrupting chemicals in the world. Birth control pills are probably one of the #1 hormone disrupting chemicals out there because they're not actually hormones, they're hormone disruptors. And so they inhibit your hormone's ability to work properly, and that's how you don't get pregnant. So if you are on birth control pills, then that's the one thing I would recommend, being off of those for 2 to 3 months before you actually test your hormones, because those will suppress your hormones. But anything else, all the lifestyle stuff, yes, definitely incorporate some healthy lifestyle strategies, because that's going to help your hormones work better anyway. So even if you're on hormone replacement, we do recommend eating a healthy whole food diet, getting plenty of fiber, getting exercise, optimizing sleep, avoiding toxins, because that everything that you do, every bite you take, every move you make, every thought you have, every interaction that you have has a hormonal effect on your body. So while hormone replacement might be necessary for women who are no longer producing their own estrogen and progesterone, it is absolutely still so important to help those hormones work better by actually living a healthy lifestyle. So answer the question, do you need to detox before testing hormones? Not necessarily, only if you need to, if you're taking hormone suppressing medications like birth control pills, then, or if you've been on hormones for a while. Typically what we will do in our practice, if someone comes to us and they're already on hormones, we want you to stay on your hormones and take the test. We usually say 12 to 24 hours after your last dose, because that's going to allow us to see where your hormones are currently at on your current dose of hormones that you're already taking, and compare that to your symptoms. So then we can see how you feel on that dose of hormones and know if you need to go up or down or have a different delivery method. And that gives us a better picture. Because if you go up your hormones and then we look at your test results and then we look at your symptoms, and your symptoms are the symptoms on hormones, but your test results are not on hormones, that can confuse things. So and anyone who works with us will give you detailed instructions on when to take your hormones last, when to do your test, and if there's anything you need to avoid before testing. So hopefully that answers that question. Another question, can hormone replacement cause you to gain or lose weight? So that is a very big question. And the answer to that is, depends on your dose. So hormones can affect your weight greatly. One of the biggest culprits that I see when it comes to hormone replacement and weight gain is the overdose of testosterone. I get a lot of women who have been on pellets or other hormone modalities from different clinics, and they are overdosed on testosterone, and that can cause weight gain and cause facial hair gain and cause irritability. And that is just, it can cause divorce because of the irritability. So that is one reason why hormones can make you gain weight. Now, when you first start estrogen and progesterone, they will help to plump up your skin and lubricate your joints. And so there can be a little bit of water weight gain that's temporary, that is a result of things getting plumped back up. So your breasts can get fuller if they've gotten deflated. Your skin can get more buoyant and like kind of do that. See how it's bouncing back. A lot of times that doesn't happen when you get older, when your collagen and elastin in your skin has gone away. And so estrogen is very hydrating and things like that. So it's not, doesn't make you gain weight, but you can have a little transition period where you have, like if you step on the scale, you might be a few pounds more, but it's from hydration. However, with testosterone replacement, when it's too much, then that can make you gain weight. Just like when people have PCOS, which is polycystic ovarian syndrome, that's a condition where you can naturally make too much androgen, so too much testosterone, and that can actually cause the inability to lose weight. And so too much testosterone or too much hormones in general. So hormones, like when you have too little estrogen, that's going to cause you, and this happens a lot as women enter menopause, they start noticing that it's harder for them to lose weight. They start getting the menopause belly, it's called all kinds of different things. And that is because when you lose estrogen, your body tries to kind of help you out a little bit. And it knows that your ovaries, because you're now not, you're in menopause. Basically what happens, let me kind of back up. So we have our regular reproductive years where your ovaries are producing estrogen and progesterone, a little bit of testosterone. And then we go into perimenopause, and perimenopause is, all it means is the time around menopause. And it's generally 5 to 10 years before menopause. And then menopause is the anniversary day of 12 months without your period. And that's when it's said that your ovaries are no longer producing anything. So in perimenopause, you're still producing hormones, just not as much. Generally, progesterone will decline first, and then estrogen will follow. And in menopause, then your estrogen and progesterone levels are going to be very, very low. And then anything after that 1 day anniversary, that's postmenopause. And so usually during perimenopause, menopause, and postmenopause, women notice that it's harder for them to lose weight. And there's 3 different reasons why. One is loss of estrogen. Your body senses that, so it knows that your ovaries aren't making as much estrogen as they need. So the other part of your body that can produce estrogen is actually your fat cells. So fat cells can produce estrone, which is a weak form of estrogen. But if you make enough of it, it can convert some of that over to estradiol. Now, you'll never have enough fat cells to compensate enough estradiol to help your bone health or your brain health or to reduce hot flashes, but it's kind of like a protective mechanism. And so that's one reason. Another reason is when estrogen and progesterone drop, we can still have more testosterone because testosterone, we only make about a small amount of it, maybe about 25% in our ovaries. And then we also make about 75% of our testosterone, or our DHEA, which is what testosterone is made from, in our adrenal glands. And so when we hit perimenopause and menopause, our ovaries might stop, but our adrenals might still be working just fine. So we might have a high or decent amount of testosterone, but a very low amount of progesterone and estrogen. And that can sometimes cause androgenic symptoms like weight gain, facial hair, things like that, hair loss on the head. And so that's another reason. Then also we become, as estrogen drops, or we become more insulin sensitive, or less, or more insulin resistant, I should say. So we don't handle our carbohydrates as well, and we can have increased inflammation, which can, that alone can cause weight gain, increased inflammation. But then also we store more of our carbs as fat when estrogen's low. So that's another reason why we notice weight gain. And then, so I said 2 reasons. And then the other reason is our hormones are energizing. And so when we have less energy because we have less hormones, we tend to put on more weight because we're not moving around as much. And so those are a few reasons why you might gain weight during menopause. And so when we balance out those hormones, it allows the body to be able to lose weight. Oh, the other reason was when we have a low amount of hormones, it's really hard for our body to maintain lean muscle mass. So you might notice that you're going to the gym, you're doing all those things, and your muscles are kind of just not there. You have more flab where you feel like you should have muscle. You used to have legs that were kind of lean, and now they're kind of flabby. That's a result of hormone decline. DHEA is a big part of that. And so replacing the hormones can allow you to maintain lean muscle. It can tell your body, okay, we don't need to store that belly fat anymore because we have estrogen. It also makes you more insulin sensitive so that you don't store as much body fat in the pancreas. And it's all in all, it's kind of like helps. But the one thing I want you to know is just replacing hormones doesn't make the fat melt off. And so you still, it does, it enables you to lose fat along with a healthy diet and lifestyle. So hormones are not weight loss miracles. You can have balanced hormones and you can still be overweight if you don't have the healthy lifestyle practices in place. But if you are doing all the things, if you're one of the people like, I'm eating a healthy diet, all whole real foods, I'm eating enough protein, I'm exercising on a regular basis, and I'm still gaining weight, then that's where the hormones will help. So in short, can hormones make you gain weight if you have the wrong amounts of hormones? So you always want to test your hormones if you're going to do hormone replacement, and you want to retest your hormones every 4 to 6 months. In our practice, we test every 4 months, just to make sure that hormones are at the right level, that everything's balanced, because it's not just about the amount of hormone, like each hormone individually, it's how they're balanced with each other. So hopefully that was helpful. And I actually have a video on menopause weight gain on this channel. So be sure you subscribe to the channel, because we're busting out videos, about 3 videos a week, and they're answering a whole bunch of questions. On those videos, I go much more in depth on each of the issues than I can possibly in this Q&A, because I'm trying to get to everybody. But yeah, check that video out if you get a chance. Do you recommend to use, here's the next question. Do you recommend using hormone replacement if you have a fibroid? So I definitely recommend testing in this case, because a lot of the times the reason why fibroids are allowed to grow is because of that imbalance of the estrogen to progesterone. So estrogen helps them grow, progesterone helps them shrink. So when your hormones are balanced, then progesterone is actually one of the treatments for reducing fibroids. So along with other lifestyle, dietary changes, reducing inflammation, looking to detox your estrogen, because we can have estrogen dominance and we can actually recirculate our estrogen if we are not able to properly break it down and excrete it from the body. So estrogen actually has a 3-phase process. And once you use your estrogen, once it goes through the tissues and it gets used, then it has to be broken down into metabolites and then it needs to be methylated or packaged up, and then it needs to be excreted from the body. So if you don't have enough nutrients, if your liver isn't working properly, if you are poor methylator and you need methylated B vitamins, or if you're constipated, so you're not getting the estrogen out of the body in your poop, because the microbiome is very important in this issue. So looking at gut health, looking at liver health, looking at inflammation are going to also be important to make sure that you're able to properly detox your estrogen. And in the supplement we're going to be giving away, the Daily Glow, there's a compound called DIM, which is made from cruciferous vegetables like broccoli, cauliflower. And that compound actually helps with that phase 1 estrogen detox. And then the methylated B vitamins help with the phase 2 estrogen detox, and making sure that you have enough fiber in your diet and healthy digestion and a healthy microbiome. That's going to help with that phase 3 estrogen detox. So hopefully that's helpful. All right, next question. Why do homeopathic doctors don't like any kind of hormone replacement? I am not sure. That would really be a large generalization to say that no homeopathic doctors like hormone replacement therapy of any kind. I don't think homeopathic doctors are not trained in hormone replacement therapy, so you wouldn't want to go to a homeopathic doctor specifically for hormone replacement, because the whole field of homeopathy, it's great. I mean, we use homeopathic remedies when we get sick and for different things. It's a different idea and a different way of treating things, and hormone replacement doesn't fall under that category. So that's not the person I would be asking about hormone replacement therapy anyways. Let's see, what's your opinion on taking bioidentical hormones, but for a 60-year-old woman diagnosed with osteoporosis? I think that's super important. Osteoporosis, the primary reason for osteoporosis is loss of estrogen. There's other secondary reasons such as poor nutrition, nutrient deficiencies, things like that. Also, some medications can contribute to the inability to build bone or quicker breakdown of bone, but the primary reason is going to be loss of estrogen. And the only way at 60 years old, I'm assuming you're in menopause, average age of menopause is 51 years old. There are some women who go into menopause in their 30s, and there are some women that go into menopause in their 60s. But generally, a 60-year-old is probably going to be past that menopause date and past the time when their ovaries are going to be producing estrogen. And estrogen is a primary necessary component to bone building. Now, testosterone and progesterone do play roles as well. So hormone replacement therapy is going to be the quickest, the easiest, and the most effective way to reverse that osteoporosis. We have women in our practice that have DEXA scans showing the difference between before they started hormone replacement therapy and after. Now, in addition to hormone replacement therapy, you're going to want to eat plenty of protein. You're going to want to do weight-bearing exercises, preferably resistance training, preferably with heavy weight if possible. If that's not possible, body weight exercises using resistance bands, that's going to be great. Making sure you're getting plenty of protein because your bone matrix is made of protein. A lot of women, when they get a little older, or even women in general, but a lot of women over 35 do not eat enough protein. So when I say enough protein, for building bones, for keeping your hair healthy, for muscle tone, you really should be eating between 1/2 gram to 1 gram of protein per pound of lean body weight. So what does that mean? Okay, so we have 1/2 gram to 1 gram. You guys understand what that means, of protein per pound of lean body weight. Now, if you're in the UK, I know you have the metric system and I don't have that conversion, but 1 pound is 2.2 kilograms, just so you can kind of do that conversion. But the reason why that is because that's enough protein to satiate you so you don't gain weight, to build your muscles, to build your bone matrix, to keep your hair, skin, and nails healthy, because they're all made of proteins. And so when I say lean body weight, so what I mean by that is think of your ideal body weight. That's what you want to calculate on the 1/2 to 1 gram. If you are 300 pounds and you're 5'5", and your ideal body weight is about 135, 140, you want to calculate it on that 135, 140, not the 300, because you'd be eating way too much protein. So hopefully that makes sense. And did I answer the question? Yes. So yes, I would absolutely recommend hormone replacement therapy to a woman who is 60 years old with osteoporosis. Awesome. Okay. When you first start BHRT, that's bioidentical hormone replacement therapy for anyone who's new and not keen to the lingo. So HRT is hormone replacement therapy, and BHRT is bioidentical hormone replacement therapy. The difference is bioidentical means that the hormones that you're putting in are identical to the hormones that your body makes. So your body can't tell the difference. And so it's just like if you are doing a blood transfusion and you're blood type A, you need blood type A to get the blood to make it work well. You can't just use any blood. And with hormone replacement therapy, it's kind of like that. So we're giving you the same exact hormones, the same exact chemical structure. They work the same way in the body versus something that's kind of like hormones, but might be made from horse estrogen, or might be conjugated equine estrogen, or might be medroxyprogesterone acetate, or might be a progestin. And those can actually cause complications in the body. And those are what the majority of conventional doctors that are not trained in hormone replacement therapy just lump all the hormones into one category. That's why you hear things like, you should only use hormone replacement therapy for 5 years, or you hear things like there's an age limit when you have to stop, or you hear things like, oh, hormones are dangerous, or hormones cause stroke, or hormones cause cancer. It's because they're lumping all hormones, all delivery methods. It's different if you use topical versus oral. They lump synthetic horse estrogen and bioidentical human estrogen into the same category. And so when I say bioidentical hormone replacement, I'm talking about the hormones that are identical to your body. And when I'm talking about things like side effects or whether it's safe for somebody, I'm always talking about the dose and delivery method that's appropriate for that person, because hormones are very individual. In our practice, we test everybody and we use the safest delivery method possible, which is topical. So topical or vaginal hormones are the safest. They do not go through the liver, so they do not create clotting factors, so they don't have any increased risk of stroke. They also don't go through the liver, so they don't form those harmful metabolites that can then cause DNA damage and lead to things like cancer or other issues. And they don't cause heart issues. And so topical hormones also are much more potent than oral hormones. So when you take hormones orally, you have to swallow them. They have to go through your digestive system. Then they have to go through your liver. And then only then, once they're broken down into their metabolites, can they go to your cells. So there's a lot going on there before they actually get to your tissues to actually act as they need. So that's why, versus topical hormones, they go into your bloodstream, they go to the tissue and they work. And so the reason why you have to take 5 to 7 times a higher dose of oral hormones than you do need topical. So topical hormones are 5 to 7 times more potent at a lower dose than oral hormones. So when I'm talking about how we do hormones in our practice, it's going to be topical. It's going to be dosed appropriately for each person. And there is a wide range. I can have 2 women come to me in my practice, 55 years old, 140 pounds each, both eat a healthy paleo diet. So they look very much the same on face level. And one woman will need 1 dose of hormones and another one will need double that dose in order to get her levels to optimal range. So it's very, very individual. And unfortunately, most conventional practitioners will just give all women a standard dose, and they don't believe testing is necessary. So they just treat all women the same. But look around. I mean, all women are not the same. We are way different. We have different metabolisms. We have different ways that we digest things. We have different preferences. We have different eye colors, hair colors. We're all so different and we're also individual. And even the North American Menopause Society, which I don't agree with everything they say, but they do always stress that hormone replacement is a very individual thing and should not be treated as a blanket recommendation. So, okay, now I will answer that question. Okay, I'm going to go back to it. When you first start BHRT, Can your postmenopause body react strongly or negative to the sudden supply of hormones, which was previously lacking? What should be expected realistically? So it depends on the dose. So when we start women on hormones, we always go with a conservative dose because we're going to be testing again in 4 months, and we can always raise the dose. So it depends on, like, if you're doing like a pellet that is extremely high dose, yeah, you can have some negative symptoms and mood. You might feel, if you do oral progesterone, a lot of times you might get digestive issues. You might have increased heart palpitations. If you have too much estrogen, too much testosterone can cause irritability, hair loss, facial hair, things like that. So it's when the hormones are too high, there can be some issues. And so starting low and gradually increasing is the best way to go. But generally with bioidentical hormones, because they are identical to the hormones that your body makes, there's not a lot of side effects at the right dose. Okay, let's see. If a perimenopause person starts BHRT, does she have to take them for the rest of her life? Your bioidentical hormone replacement program is for 1 year. What happens after? Okay, yeah, so our bioidentical hormone replacement program that we have in our practice, the Healthy Hormone Club, that includes testing, initial consultation, testing every 4 months, unlimited support from our hormone replacement staff, and also all of your hormones shipped to your door. So we package that all together for either a 1 annual price or a monthly price. We sell it in an annual program. So you can either do monthly payments or pay up front. And that's each year. You can either renew it or you can cancel. So that's how we do it in our practice. And so after the year, you can decide you want to keep going. And then if you got a discounted price or anything like that, you lock in your price and you keep paying the reduced price. But do you have to keep going? Absolutely not. If you're in perimenopause, probably the best time to start hormone replacement therapy is in perimenopause, before everything kind of starts, the crap hits the fan, so to speak, before like your bones start atrophying and your vaginal tissues start atrophying, you start to have painful sex and all the different things. Let me just take a glass of water. So before all those things happen, it's great to like catch it before, and then you can kind of like coast through on keeping your hormones from declining too much. But it's how long you stay on hormones is definitely a personal choice. So some people, like myself, like Oprah, like Suzanne Summers, like Demi Moore, like a lot of people who talk out about hormones, they say, I will never go off my hormones because I feel good. I want to live a long time. I want to I want to have healthy relationships with my spouse. And so if you like the results you're getting, then yeah, you probably will want to stay on them, because when you go off hormones, because it's hormone replacement, right? So basically in perimenopause, you're still making some hormones, so your dose will get adjusted. Eventually, every woman will go into menopause. So eventually every woman's ovaries will stop working sometime around age 51. Give or take 5 years. Some women have early menopause, some women have late menopause, but generally speaking, every woman will go into menopause at some point. At that point, your ovaries will no longer make very much hormones at all. There's always a minute level of hormones that your body will make. But when you're replacing hormones every day, you're taking the hormones that your body would make in that 24-hour period, let's say, so to speak. And then when you stop taking hormones, you don't have to wean off your hormones or anything like that. So you stop taking them, and eventually, usually within a few months, your symptoms of low hormones will return because you're no longer putting the hormones in. So for some women, they might want to do it for 5 years, for 10 years. They might never want to do it. It's up to you. I believe in medical freedom and freedom of choice. And I don't think that every woman wants hormone replacement, but I think every woman should have the opportunity, should she want hormone replacement, to have it. Because the truth is, multiple studies have come out recently. The most recent one I saw, there's actually 2, in June, the cancer.org publication. So it's like a huge medical peer-reviewed study by cancer.org. And they basically said hormone replacement therapy reduces all-cause mortality. So it reduces the risk of heart disease, Alzheimer's, osteoporosis, really the risk of dying from any reason. So women who take hormone replacement therapy are going to live longer. Now, there are compounded benefits, like let's say for bone health, if you're on hormone replacement therapy for 10 years, then like you extend your bone health for 10 years more. So if you stop, you still have built up your bones for those 10 years. So you have like a little bit over someone who hadn't. And then also the North American Menopause Society, NAMS, they also came out and said that hormone replacement therapy is, one of the things that will help women to reverse osteoporosis, live longer, reduce heart disease, all of those things. So I personally would stay on it as long as I could. There's no end date. With synthetic hormones, there are risks associated with those, and you do only want to stay on them for as short as possible. For me, never going on synthetic hormones is probably are bioidentical hormones out there, even by prescription, and you can find a doctor who will prescribe them, or you can work with us. We work with women all around the world. But yeah, I mean, there's no reason to stop unless you just don't want to do it anymore. And that's always up to you. There's nothing negative that's going to happen that's increased because you did hormones. You're going to actually have decreased risks, but you won't have all the benefits continue once you stop. So hopefully that answers that question. Let's see. If hair on the head is thinning, which hormone is best to help with that? And also stop growing on chins. Okay, so if your hair on your head is thinning, there's a few different hormones that come into play here. So one, it could be testosterone. So testosterone, when we have healthy testosterone levels, that's awesome. Like that's what we want. But when our testosterone is up here and our progesterone is down here, then that amplifies the androgenic effects of testosterone and how it breaks down to DHT. So DHT is, a lot of times it's talked about in relation with prostate health for men, but testosterone breaks down two different pathways. So it breaks down an A pathway and a B pathway. The A pathway goes to something called DHT. And DHT can, it's the more androgenic form of testosterone. So it's the thing that causes the facial hair, acne, greasy skin, hair loss on the head, aggression, irritability, and weight gain in women. So it's more a problem for women than it is for men. When you have adequate levels of progesterone, that balances out the high testosterone. So now it's less androgenic. And so progesterone can definitely help if that's the case. Progesterone also helps with hair thickness and fullness. If you've ever been pregnant or you know anyone who is pregnant, their hair always looks so soft and full and beautiful and shiny. That's from the progesterone that's super high in pregnancy. The other hormone that comes into play is thyroid. So low thyroid, hypothyroidism, Hashimoto's thyroiditis, very, very common symptom is going to be hair loss. So if you also have constipation, cold hands and feet, dry skin, feeling tired all the time, gaining weight, then you may want to get your thyroid tested to see if possibly low thyroid is a cause of the hair loss. But the hair on the chin, it can be a little bit genetic. Women from places like Italy, but I'm Italian, and like my mom always had hair on her chin. It wasn't because she had high testosterone, it was just genetic. But a few hairs on the chin are normal if you have to pluck one every once in a while. It's generally not a problem, but if you start getting a lot of hair, mustache, chin, even your chest, then that usually is an issue with your androgen balance. So a couple of things you can do. One of the things you can do is there's some herbs that can help push the pathway of the testosterone down the less androgenic pathway. Saw palmetto is one, pygeum and nettles. There's actually a combo that we usually recommend to people that has all three of those in it. So saw palmetto, pygeum, and nettles. Also, omega-3s can be helpful here. And then looking at your hormone levels is going to be a great way to know if that's an issue for you. Also testing the thyroid. Are you familiar with Nutrafol as a product to help with hair growth? I am familiar with it. It's a vitamin, so it has like all your regular nutrients. I have used it before, but can't really say whether it did anything. The Daily Glow vitamin has everything that's in the Nutrafol. So that's what I take and that's what I recommend, but it's not going to hurt you. I just don't think it's going to really do much for your hair growth. The only thing that you can actually do, because hair loss, I'll just talk about that for a second. So there's hormonal reasons for hair loss that we talked about, but then there's also other reasons for hair loss. Just like we cannot determine or we can't change the age at which our hair goes gray, we also can't genetically change the age at which we start to lose hair. Everybody starts to lose hair at a certain age, and there is a genetic programming to your hair follicles. So that's one reason why people might be losing hair. It just might be genetic. Another reason is stress. So stress and emotional, physical stress, and also biochemical stress, things like mold, things like toxin exposure, getting super sick, like getting COVID, stuff like that. That can actually cause hair loss. And what happens is at the time of the stressor, the car accident, job loss, move, death of a family member, something like that, at that time, you're going to feel that stress and it's going to affect your hair follicles. However, you don't see the hair loss for 3 months. So what you're doing today will affect your hair 3 months from now. So that's another reason. It can be stress. The good thing about stress hair loss is that once you resolve the stressor, your hair will grow back. Same thing with hormonal hair loss. Once you resolve the hormonal issue, hair grows back. Genetic hair loss, it doesn't tend to grow back. Other reasons for hair loss are going to be nutrient deficiencies. I talked about protein earlier. Also, minerals are important. So making sure that you're taking like a really good multivitamin sold by a physician. There's so many crappy supplements out there that are sold by like internet marketers that know nothing about health. So be careful if you buy stuff that's advertised like on Instagram or on Facebook or just online. If you get little ads when you're reading like a news article, be careful with those. Really looking for brands that are sold in doctor's offices, brands like Designs for Health or Standard Process. There's a lot of great ones, or brands made by doctors are going to be much higher quality. There's a pharmaceutical grade, and then there's consumer grade. Pharmaceutical grade, it's going to be more absorbable, it's going to have more purity, and it's just going to be better for you. So Nutrafol is in that category though, so I don't have anything against Nutrafol. I just haven't seen the benefits of it. So and I have worked with about 10 or 12 women that were on it for a period of 6 months, and we really didn't see a difference. So and it's very expensive, from what I understand. But if you're lacking those nutrients, then the nutrients in Nutrafol can definitely be helpful. Well, I still have hot flashes after having surgery. Why do I still have hot flashes after having surgery 23 years ago? You didn't say what type of surgery, but I'm guessing that maybe you're talking about a hysterectomy. And that is because estrogen. So estrogen is the main driver in hot flashes. Progesterone can come into play, like if your estrogen to progesterone ratio is off. Sometimes for women in perimenopause, giving some progesterone might help with hot flashes, but the main driver in hot flashes is estrogen. So estrogen is necessary for your brain cells to use the fuel, to use glycogen. Glycogen is the main fuel for your brain, and estrogen is necessary for that metabolic process to happen. And so when we have very low estrogen, different areas of our brain cannot work properly. And one of those areas is the hypothalamus. The hypothalamus is where your temperature regulator comes into play. When there's not enough estrogen, temperature regulation is a little bit erratic, and that can cause hot flashes. And so even if you've had a hysterectomy 23 years ago, you can still be having hot flashes if you haven't replaced your hormones. We have women that I work with who come to me and they're in their 70s and they went through menopause at age 49 and they're still getting hot flashes. The majority, I would say the vast majority of women will have hot flashes for like 7 to 10 years following right before menopause to following menopause. So it's usually about 5, 10, 7 years in that ballpark. But there are about 20% of women who have hot flashes until they replace their estrogen. So Janita, if you haven't replaced estrogen, that's why you're still having hot flashes. And so you would actually be a really good candidate for estrogen replacement. And when I say estrogen replacement, we always will replace all of your hormones up to optimal levels because it's really about balance. And so even though there are a lot of doctors that will say that women who don't have a uterus because they've had it surgically removed do not need progesterone, I find that to be so wrong. And the reason why is because progesterone is really important for your brain as well. Progesterone is important for calming moods. It's important for our sleep. Progesterone plays a role in bone health. It plays a role in gut motility. So progesterone is a very important hormone, and our body wouldn't make it if it didn't need it. And so it's not just for creating babies. It's not just for thinning out the uterine lining. It is for so many other things as well, mainly brain health. Let's see. Awesome. All right, I'm going through the questions. So, all right, hi everybody, by the way. Awesome. So let's see. I'm going to do raffles in just a few minutes. How long can you take DIM? I was told by a doctor to only take it for 2 months. Is it okay to take it long term? I always recommend, as long as you're, especially for women who are on hormone replacement therapy, to keep taking it because it's going to just help estrogen detox. And it's a natural compound found in cruciferous vegetables. So I'm not sure if the doctor also told you to stop eating broccoli or anything like that. But I think the craziest thing, I'm going to make a whole YouTube playlist just on the craziest things I've heard doctors say, because it's insane. But yes, you can totally take DIM long term, but you just want to make sure when you're taking it, because there's a lot of supplements out there that have ridiculously high doses of different things, like DIM 10,000 or something like that. No, I'm like 150 milligrams of DIM on a daily basis is good. It's healthy for proper estrogen detox. Let's see. What created the estrogen grow? I'm not sure that I see that. I'm not sure I understand that. So it's probably a typo. I know that when you're typing sometimes on your phone, it doesn't come through. So I'm not sure. Just go ahead and re-ask that question. Awesome. Is starting BHRT at the age of 65 too late to reverse osteoporosis and build my muscles? Absolutely not. So when you start BHRT later, generally more than 10 to 15 years after you've gone through menopause, we usually will start you at a lower dose, and it does take a little bit longer to see the effects of it than someone who starts younger. However, you can still get the bone building properties for reversing osteoporosis and osteopenia. You can still get the muscle building. You can still get the mood, the vaginal dryness, reversing vaginal atrophy, helping with UTIs, restoring skin laxity, reversing joint pain, like there's so many benefits. And yes, you can still get all of this. It just sometimes takes a little longer. Like generally on hormone replacement therapy, this is another question that came in. Generally you're going to see results between 1 to 5 months when you start. It usually takes 1 to 5 months to see the benefits. Now, some of the benefits will come sooner, some of them will come later. Bone building does take about 12 months on hormone replacement therapy, and then you get a DEXA scan and you see a benefit, and then each year that compounds. So for someone who's 65, absolutely, you're still totally in the age range where you're going to get the benefit. I would say over 70, the benefits take longer, but 65, you're totally fine. I would definitely go for it. Definitely going to help you build your bones. Let's see. Do hormones help with sleep? I can't get to sleep, usually get 2 to 3 hours, and I toss and turn the rest of the night. Sharon, yes. I'm sorry that you're not sleeping, by the way. So hormones are so important for sleep, and there's several different hormones that come into play. Progesterone helps you to fall asleep, and estrogen tends to help you stay asleep when you have the two of those balanced. Melatonin is another hormone that comes into play, as does cortisol. cortisol is our wake up hormone. We think about it as a stress hormone, but a lot of people have imbalanced or backwards cortisol patterns. So when cortisol is supposed to be highest in the morning and wake us up, and then it's supposed to gradually decline throughout the day. And then as evening comes, melatonin starts increasing, right? And so that's supposed to be how a healthy sleep-wake cycle happens. And then progesterone is closely tied to the neurotransmitter GABA, and those are calming hormones. So those help you calm down, those help your body relax. And so generally we'll dose progesterone at night, and it really, really helps with sleep. Insomnia is probably one of the first symptoms that women tend to notice as they go through perimenopause. So as the symptoms starting perimenopause, you're going to notice your periods might start to get irregular. You might notice that you start not sleeping as well. You start getting irritable, start maybe vaginal dryness. Those are kind of maybe a little bit of hot flashes every once in a while. Those are usually like the beginning symptoms of perimenopause. Not everybody experiences the same thing though. But sleep issues are probably number one. So progesterone really helps with that. But other things that come into play could be food sensitivity. It could be light exposure. So wearing some blue light blocking glasses or getting off your devices at night. So having a nighttime routine, looking to see if there's any foods that you're sensitive to that you might be eating late, not watching the news, right? and whenever you don't watch the news, also don't put on like a docu-series about like a serial killer either, because that's like a lot of times people like turn off the news, but then they'll watch something equally as like stressful. And so that's really important. But yes, hormones definitely help with sleep. We've got many, many testimonials from women in our Healthy Hormone Club that like their lives have changed because they can now sleep. I mean, when you don't sleep, you are so irritable. You can be so, you can gain weight a lot easier. So your metabolism actually can reduce by 10 to 15% just from not sleeping. Your digestion is not as good. Your thyroid doesn't work as well. Your immune system is less effective. Not sleeping affects your body so much. And so it's for longevity purposes as well. Just getting quality sleep is so important. So balancing your hormones, definitely important, but also looking at some other things as well. Let's see. I have a difficult time going to sleep in addition to feeling fatigued despite working out and trying to eat right. What can I do to get better sleep? I do sleep 8 hours a night, but I'm also tired. So it's kind of same answer that I just gave for the last question. Yeah, so there's so many factors that can affect sleep, but definitely if you're in the perimenopause and menopause age range, if you're over 35, I would definitely get your hormones tested, right? That's probably the number one thing you can do is get your hormones tested to see where you're at, and then replace only what you need. Because if you're like 35, 40, 45, you might just need progesterone, or you might need a little DHEA to boost up your testosterone. You might just need a couple of things. You might need some melatonin. So that's where the Glow PM comes into play. And we're going to give away that in just a second. Maybe one of the sleep ladies will win it. But we'll do that in just a sec. But there's so many factors that come into play, but definitely hormones are a big part of it. So I would definitely test your hormones to see where you're at, and then just replace what you need. And then every 4 to 6 months, you can retest and see how things need to be adjusted. Are troches for BHRT as harmful as oral hormones? So a troche is like a little, I want to take a little like compressed thing that dissolves in your mouth. So it's mostly sublingual. So the sublingual part doesn't have to go through your digestion, but studies show about 20 to 30% of the hormones are actually swallowed in a troche, just because you can't help but to swallow them. That gets into your saliva. And so those can cause the harmful metabolites. And so for that reason, they can fall into the same category, but they shouldn't. But because so much of it actually gets swallowed, a pretty high amount. And again, you're using a little higher doses than you would with topical. So they are better than oral hormones. I will say they're better, but they do still have some of the risks. Awesome. I think I answered the questions there. So let me go ahead and do a little raffle. So how I'm going to do this is I'm just going to I'm going to kind of close my eyes and I'm going to pick something because I don't usually have somebody on with me, but I don't have anyone on with me today. So I will pick somebody. All right, so I'm going to close my eyes and whoever I have my fan. Okay, so Dawn Lakretsky, I think I'll say that right. Dawn Lakretsky. I'm going to go ahead and if you can email us at support@glownaturalwellness.com. That's support@glownaturalwellness.com, and give us your name and your address where we can send you your prize pack of Glow PM and Daily Glow. Those are our two supplements I actually formulated myself. And they are super high quality, super high potency, food grade. And so you're going to get that for free just for showing up and asking a question. So let's do another one. Okay. All right. So I've got Deborah 345. I don't know if that can't possibly be your last name, but Deborah 345, we're going to go ahead and send you the same thing. So a bottle of Daily Glow and a bottle of Glow PM. And I didn't actually see your question earlier, so I'm going to go ahead and read that now. So it says, I was dismissed by my nurse practitioner who is providing me with hormones. Her new protocol is no hormones after age 30. I have no ovaries. I'm healthy, yet I would not agree with her from being dismissed. So it sounds like she just cut you off of your hormones. That is absolutely criminal. That's not fair. Yeah, there's no reason other than a very old science that applies to synthetic hormones that says that women should only be on their hormones for 10 years. That is basically, it was developed because they were putting women on conjugated equine estrogen from horses, and they were putting women on medroxyprogesterone acetate, which is shown to cause stroke and all kinds of other issues. And so because of that, they're like, okay, to cover our butts, we need to only have women on these hormones for as short as possible. We're going to cut them off after 10 years. But bioidentical hormones don't fall into that same category, and they extend life. All these publications are now saying that all-cause mortality is reduced. And what that means in common English is the possibility of dying for any reason is reduced when women are on bioidentical hormone replacement. So absolutely no reason. Definitely contact us. You're going to get the free bottle of Glow PM and Daily Glow. So make sure that you email us at support@glownaturalwellness.com. And I'd love to help you with your hormones. So definitely reach out if you want help. We work with women all over the United States and also in most English speaking countries. We'll ship hormones to you and your testing. And so, and we'll meet with you either via Zoom or via phone call, whatever's easier, and you get unlimited support. So when you have questions, there's so many women I talk to who are on my YouTube channel, on my email list, who have all these questions about their hormones, and they cannot talk to their own hormone practitioner. And the reason why, I'll tell you that only less than 20% of OBGYNs and endocrinologists, these are practitioners that we think we need to talk to about our hormones, only less than 20% of them have any training on hormone replacement, any training. And those that do, it was an elective. And so it's really important that if a doctor is telling you something about you don't need hormones, or everyone has those same health problems when they get older and that's just as good as it gets, or that hormones are dangerous, or any of those things, make sure that they actually have some education in hormone replacement, and make sure that they actually have read a study since 2002. All the studies coming out now actually show that hormones are safe and effective. And so, doctors, a lot of times they graduate school and then they're training for their continuing education. They just do whatever's easiest. And they usually are trained by, they're training sponsored by Kellogg's or Procter and Gamble or Johnson & Johnson, our pharmaceutical companies. And so I get alerts to my computer every morning of the latest research coming out about female hormones, menopause, hormone replacement, all of those things. And it's what I love to do. And so I read it all the time, but most doctors don't. And they don't have time to talk to you about all your symptoms and all the things. They're just going to look at you and say, okay, you have high cholesterol, you're tired all the time, you're gaining weight. you're having trouble sleeping, sounds like you should be on a statin and an antidepressant. Most doctors will just give you an antidepressant for the symptoms of menopause. Menopause is not a deficiency in, Paxil or any of the antidepressant, it's not an antidepressant SSRI deficiency. It is a deficiency in hormones. And so in natural medicine, we always treat the root cause. We treat the root cause of every condition. And the root cause of menopausal symptoms is low estrogen, low progesterone, in some cases, low testosterone, DHEA. And so we're going to treat those by replacing those so that the symptoms can go away. So you don't have to be stuck on medications for the rest of your life, right? That's the goal, is that you don't want to be on a medication for your cholesterol and a medication for your blood sugar and an antidepressant that you don't even need because you're not depressed, you're just lacking hormones. And so it's really unfair for women when they go to their doctor, because they can explain to their doctor all the symptoms of menopause, and their doctor will be like, okay, well, that's kind of how things are, just eat better and exercise, and here's an antidepressant. But a man will go to their doctor and he'll mention 3 or 4 symptoms of low testosterone. He'll immediately get tested, and then he'll immediately get a prescription for testosterone. And it's just not fair to women. So that's why we're doing these Q&As. And so I'm so super excited about that. All right, so I'm going to go ahead and let's some more questions here. Go ahead and answer. I'm extremely emotional recently. How is that related to an imbalance in hormones? Yeah, so that is super common. Estrogen and progesterone control our moods so much. If you think about like puberty, if you think about pregnancy, those are times in your life when hormones are a little bit crazy. Hormones are either going up or going down, and you get irritable, you get moody, you get emotional. If you've been pregnant and cried at a commercial, that's hormones. And then when your hormones are dropping, you have the same kind of thing. So this is a time in our life when hormones are changing and dropping, and our estrogen helps us to kind of like feel upbeat. Our estrogen is an energizing hormone, and then progesterone helps us to feel calm, helps us deal with situations, helps us be more kind of calm and relaxed. And then our DHEA and testosterone, those help us to be confident, sure of ourselves. Too much of it can lead to aggression and irritability. So hormones definitely are so highly related to our moods and our emotions, for sure. Can bioidenticals help with migraines? Yes, if the cause of the migraine is hormone fluctuations or hormone deficiency, which that's very common. However, there's other causes of migraines as well. So if the cause of the migraine is, let's say, mold exposure, then the hormone replacement will not help with that. So if the root cause is hormonal, then yes, hormone replacement can help with migraines. Let's see. Can I order testing through your site? Yes, absolutely. You can order hormone testing through us, and you can also order the hormone replacement through us as well. The hormone, Deborah says she was cut off. No, you don't get cut off. You just have to find a different practitioner to help you. Let's see. I wish you had done this years ago. My doc told me no hormones, period. I had terrible symptoms. I am so sorry. I wish I had done this years ago too, but I'm glad I'm doing it now, because it's so unfortunate that women are not getting at least the opportunity to choose for themselves. And, even all of the guidelines that are out there that doctors follow, like the 10 years or only give women antidepressants, all those guidelines are guidelines. They're not rules. And we really have to start treating individual patients for their individual needs. And so that's really what this whole channel is about, and really why I love doing this for you guys. And so I'm super excited that so many people showed up today to get their questions answered, but I'll keep doing these every other week. Please pop down in the comments if you like this time, or if you have other options. And then also continue to post your comments under my videos, because those are questions I will definitely answer. Oh, Joy, welcome. Thanks for being here. She's on BHRT and loves it. So I'm glad to hear that too. There's so much possible for women. And, I always say that your last period is not the end of your story, right? That's the beginning of something new. And so we can no longer just say, women are done once they don't have periods anymore. Women are living 30, 40, 50 years and more after their last period. And so we really have to look at quality of life. It didn't used to be that long ago that women would die. Lifespan wasn't that long. Women would die in their 50s and their 60s. And so there wasn't really that much concern, and there's not really that much research about the menopause timeframe because it didn't last that long, but now it's lasting a very long time, and we have to look at ways to extend life. And one of the reasons why I got so involved in this topic is because I was actually told I was never going to have kids and that my ovaries had failed at age 20. So I spent the majority of my adult life thinking I was in menopause, when truth was it was a misdiagnosis. But I started researching at that point. And now I have a son, his name is Paxton, he's 7 years old now. And I want to live a very long time to see his kids graduate, to see him graduate from high school, to see him have kids. And so the more things I can do to extend my life, the better. All right, I am going to go ahead. Oh, Julian, thank you for saying it was great. Awesome. I'm going to go ahead and do one more raffle. What I'm going to do this time is I'm going to do a signed copy of my book and also a free entry into our 21-day metabolic rehab program. It's a 3-week program to help to kind of reset your metabolism, detox your liver, and help to balance your hormones kind of in a natural way. So it's not hormone replacement, but it's all the other things that are going to help support hormone replacement or support healthy metabolism, healthy adrenals, and healthy thyroid. So that will go to, okay, ready? That's going to go to Melanie Vance. So Melanie, you're the one who asked about the emotions. So this will actually help you. There's a lot of great information in that program and also in the book to help you with that as well. So I'm going to go ahead and close out. We've been going for a little over an hour. So thank you so much. Please subscribe to my channel. Please share this with your friends. Share it with any woman who you think can benefit, because you guys can help me get the word out about menopause, perimenopause, hormone replacement. Really helping women support each other is what this is all about. And I'll continue to come to you with more information and more videos as time goes on. So thanks so much. We're going to wrap it, and I appreciate you being here today. Take care. Bye-bye.